Well, good morning, everybody. A little bit higher? Good. Can you hear me in the cheap seats at the back? How about here in the expensive seats in the front row? You know, I've been doing this for a long, long time, and I've never had a warm-up act of a governor and a first lady in my entire career, so I'm a little bit humbled and a little bit over the top with my ego right now. The First Lady alluded to it about how we met, and I'll just tell you, I'll fill in the details a little bit just to get us going here this morning. It was a year ago tomorrow. It was a year ago tomorrow that I traveled here to North Dakota to speak at an event hosted by First Step Recovery. The conference was in Fargo, and in the crowd that evening, I was introduced to a woman and her husband. He was running for governor of this fine state, and together, well, as we know, they made a very impressive couple, especially in my eyes, because not only did they come to the private reception for public officials before my event that night, but they stayed for the event. And not just for a couple of minutes, as is typical of candidates who are running for office or even elected officials, where they'll come and they'll shake hands and they'll say hi and then off they go. No, this couple, they stayed for the entire 90 minutes that I talked. Not only that, but that night they hung around afterwards when the crowd was thinning. And not only that, they were actually the last ones to leave. They were like groupies. They were kind of hanging on, literally. Only at the end of that evening did I fully understand what had brought them to the event, why they had stayed, and stayed to the very end. It's for the same reason that all of us are here gathered today. Thank you, Governor Burgum. Thank you for your commitment to make the issues that we will talk about today a critical platform of the foundation of your leadership. And thanks to the only person who could have upstaged you today, Catherine Burgum, a first lady who has had the fortitude, the courage, the vision, and the talent to take the adversity of her own personal experiences a long time ago and turn them into this unique opportunity to reinvent recovery for the sake of those who still suffer and for the sake of those who are not yet here today. Thank you, Governor. Thank you, First Lady. I'm honored too to be part of this. I'm honored to be part of this momentum gathering. I've been around a long time, but it isn't often that I get to do this. And by the way, I have to tell you that for the record, that not only is this a unique topic for me to participate in, a gathering to reinvent recovery. Usually we're always talking about the problem. We're never really gathering like this to talk about the solution. So not only is it unique for me from that perspective, but in my 23 years at Hazelden Betty Ford, I've given thousands and thousands of talks, from homeless shelters to corner offices of Fortune 500 companies. I've spoken to inmates behind bars, college students on campuses, first responders, church congregations, treatment providers. And in those decades of carrying the message, I've carried it to politicians from both parties at state capitals and testified before the United States Congress, and I've shared my story of recovery with President Bush in the Rose Garden in the summer of 2001, just before 9/11 changed everything. Over the past 23 years, I've also carried my message to Oprah, Larry King, Good Morning America, National Public Radio. But in this 23 years of carrying this message, as I said, this is an unprecedented moment for me, not only because we're talking about reinventing recovery, but this is the very first time in 23 years that I've ever stood on the stage anywhere and carried the message wearing my favorite pair of blue jeans. I just love the way you all do things in North Dakota. Okay, so here we go. I'm used to talking for a long time, And I know we've got to squeeze it down today because we have a very ambitious agenda. So I've got a time clock over here. And I'd ask everybody as we get ready to go here that we put a special prayer in for the teleprompt guy back at the back, Kyle. Because he's going to have to keep up with me. And he's going to have to keep up with me, not just as it relates to time, but because I tend to go off script quite a bit. So Kyle, we're all praying for you back there. In 1995, I spotted this classified ad in the Minneapolis Star-Tribune. It said, "Help wanted, public policy specialist, Hazelden Foundation." You know, when I opened that paper that morning, Sunday, November the 19th, 1995, it was like a bolt out of the blue. I was electrified. Struck by lightning and electrified all at once. You see, at that time in 1995, I was a freelance journalist, which in other words means I was unemployed. With a wife who didn't work outside the home and 2 young baby boys in St. Paul who were very hungry. And so not only was I a bit desperate and eager to find some work, but I was trying to figure it out at a stage in my own journey with the infinite wisdom of 13 months of recovery from addiction. Well, I mean, what did I know, right? 13 months of not drinking and drugging, but hardly enough time to really have much of a perspective on anything relative to my own life as a man in recovery. And an even thinner perspective and a dearth of knowledge on public policy and public advocacy involving state and federal laws about my illness, addiction. Sure, I knew a lot about addiction and treatment, my own. I'd had plenty of practical experience in that arena. I'd spent the last 6 years between 1989 and 1994 trying to figure out how to find recovery and stay in recovery. From 1989 until 1994, I was in and out of crack houses in Harlem, New York, and St. Paul, Minnesota, and Atlanta, Georgia. And every time I'd come out of a crack house, guess what? I'd end up in treatment. My first treatment was at Hazelden in Minnesota, the land of 10,000 lakes and 10,000 treatment centers. In 1989, I discovered that it was real easy for me to stop using. That wasn't my issue, stopping my use of crack cocaine and malt liquor. That wasn't my issue, stopping. I'd stopped 1,000 times, but I couldn't stay stopped until 1994, 5 years later, when I came out of what I pray is my last crack house in Atlanta, Georgia. As I said, I gained traction and I found sustainable recovery on the morning of October the 12th of 1994. Sustainable recovery from a chronic disease. I haven't done it perfectly, but since the morning of October 12th of 94, I have been committed to my recovery one day at a time. And so, it's 13 months later, and I'm sitting in St. Paul, Minnesota, or I'd moved back there, and I open up the paper, and there it is, wanted public policy specialist. And I said to myself, I can do that. Let's be a public policy specialist now that I've grown up. And so I applied for the job. And it was a stack of resumes, probably this high. No kidding. Hundreds of applicants, all people who were, well, far more qualified than I was when it came to public policy and advocacy around addiction. But I applied for the job, and guess what? I got it. As I said, I got that job with all the infinite wisdom of 13 months of recovery. Go figure. On my first day on the job, a few months later, in February of 1996, my boss said to me, the boss being the CEO of Hazelden, my boss said, "William, I want you to go out and I want you to change public policy around addiction. Get insurance companies to stop discriminating against people and families with addiction. Expand access to care in the public sector too, and help end the war on drugs and shift those dollars away from tough law enforcement and interdiction and towards prevention, research, treatment, and recovery support." My boss said, "William, go out there and change public policy and get Republicans and get Democrats to understand that addiction is a bipartisan problem that demands a bipartisan solution. Yes, William, go out there and change public policy. And while you're at it, why don't you also smash the stigma?" It wasn't funny back then. Go out and smash the stigma. Make the public understand, as you all said today, that addiction does not discriminate. But also get them to understand that recovery shouldn't discriminate either. Drive home the fact that what? Treatment works and recovery is possible. Go for it, William. You can do that. Well, as I said, in all my infinite wisdom of, at that time, a few more months of sobriety, 16 months, I said, well, I thought about what my boss had just ordered me to do, and I said, sure, I'll do that. I'll go out and I'll change public policy and promote advocacy and get rid of stigma. I said, I'll do that. Where's the money? You just don't do it by spreading fairy dust into the ground. Where's the money to change public policy? Where's the money to get rid of stigma? Well, I work for a healthy not-for-profit, the Hazelden Foundation, now called the Hazelden Betty Ford Foundation, because we found the need to merge as two not-for-profits in this era of incredible change around not healthcare reform, but healthcare implementation. And so even way back then, we were a healthy not-for-profit, but we didn't have the kind of money to lobby these issues in Washington or in state capitals, whether it was St. Paul or all the other states where we had operations. We just don't have that kind of money. We don't have the money to go up against the liquor industry or the beer wholesalers or all those people who are lobbying against us. So we didn't have the money, and I said to my CEO, where's the money? And he explained we didn't have it, and I said, okay, no problem. I can do this without money. Where are the troops? Where are the troops? It was Winston Churchill that once said the scariest thing about being a leader is looking over your shoulder to see that nobody is following. And in 1996, really not that long ago, for some of us who are getting to be old timers now in our late 50s and early 60s, in 1996, we didn't have really very many troops when it came to the issue that brings us here today. It was on that day, February of 1996, my first day on the job, that I learned a lesson. The First Lady referenced it earlier. I learned that when it comes to HIV/AIDS, or breast cancer, depression, or muscular dystrophy, well, the public and the policymakers, they knew all about those illnesses and what to do about them in terms of treatment. Why did the policymakers know that? Because people with those illnesses and their families, people with those illnesses and their families have been standing up and speaking out and marching in the streets and meeting with their elected officials and engaging the news media for years, relentlessly for years. People with those illnesses have been standing up and speaking out, using their own faces, their own voices, their own lives to make their point, to make their case. But when it came to my illness, addiction, or substance use disorder, as we now call it, well, there was a lot of misperception, misunderstanding, ignorance, tolerance, and stigma. Not just in 1996, mind you, not just when I came on the scene in 1996, but this ignorance, this intolerance, this misperception, and this stigma had been alive and well way back, way back. It wasn't new to my generation. This is the curriculum in colonial New England in the late 1700s. There was no prevention, intervention, treatment, or outcome if you had a drinking problem. You drank, you got worse, period. Nobody got better. You can go back down, Kyle, come back there. Oh, perfect. The first drink leads to ruin. Nobody got well in the 1700s. Nobody got well in the 1800s. I'm sorry, this is a touch out of focus. You can't really see it there, but this is from Harper's Weekly. Harper's Weekly was as influential in the 1800s as Oprah and Larry King and all those other talk show hosts are today. And this is called the Bottle Imp, and it shows what happens when the alcoholic drinks himself into oblivion. Look at this. This man is being taunted by his demons. And guess who's still holding the glass and the bottle? The alcoholic. And so not only did the image of the alcoholic begin to take on something that was less than human, but the tolerance level by the public about our illness began to shrink, because despite the consequences of the alcoholic's use, in this case, he's being tormented by demons, he's still drinking. And so any empathy that might have existed for us began to go away. The poor drunkard, more helpless than a child, and there he is on the ground, lower than the child, begging for a drink. In other words, the public saw us. They saw us as all those images back in the 17 and the 1800s. And they see us too, the fact that alcoholism affects not just the alcoholic, but it affects the family. In this case, the baby dies. But again, look who is still holding the bottle. This man has suffered the tragedy of the loss of a child, but he cannot stop drinking despite the consequence. And so, the tolerance, the understanding, the empathy for us faded away long before I ever came on the scene. And finally, domestic violence. We know it here in North Dakota. The alcoholic fights with mom in this case, and dad kills mom with the bottle, literally and figuratively. The potency of the stigma of how society viewed the alcoholic and the alcoholic's wrath, always the focus was on what? The problem. Whether it was the problem in North Dakota, Minnesota, or wherever you come from, the public and the policymakers always focused on the problem. And how can you blame them? That's all that we as a society knew. Nobody ever got well with this illness. We died. Or if we were lucky, we were locked up. And there, to your point, Governor and First Lady, we got this war on drugs. Now, we got this war on drugs long before any of us were around in this room. This is called the Women's Holy War, under the banner in the name of God and humanity. There we are, the woman leading the fight, a holy war, one under the banner of the United States of America. This became a patriotic fight. It was us as a society against them, the alcoholics and the drug addicts. Richard Nixon is credited with coining the phrase the war on drugs in 1969, but the woman's holy war was alive and well in this country long ago. And by the way, how did we fight the holy war? Well, one way we thought is if we get rid of the supply, what will happen to the demand? Nothing. Nothing. Prohibition came along and punished irresponsible drinking, but the rest of us just kept drinking. And so you got the holy war, and then you got the war of today. Then and now, one that focused on the problem with tough law enforcement and interdiction. And by the way, addiction is not an excuse, but it is an explanation. And so you do the crime, you do the time, stone cold sober or stoned out of your mind. Addiction is not an excuse. You break the law, you should be held accountable, however the local authorities decide to do it. But it was always one that focused on the problem with tough law enforcement and interdiction at the expense of the solution, at the expense of the people who were sick with this baffling illness. 200 years ago, and nothing much has changed until recently in our policy and in our stigma. Even though in the 1930s, as you alluded to, in the 1930s, a recovery program that was born in Akron, Ohio, well, it was born and it spread west to the Dakotas and it spread east to the East Coast. And treatment centers were born, Hazelden in 1949. And despite this war on drugs, the stigma, people began to recover in mass. We began to get well. Not all of us. It's a chronic illness. There is no cure for addiction. There is a solution, thank goodness. Otherwise, a lot of us would be misbehaving here today. But there is a solution. And yet, when I came to Hazelden in 1996, and I knew we didn't have the money, and I said, where are the troops? And I couldn't find us. This is why. That's the image of the addict and the alcoholic, not in the 1700s or in the 1800s, but in 1997. 15 months after my first day on the job at Hazelden in May, I think it was, of 1997, this article appeared. It was an important article, no doubt, with insights into the science and research about addiction, how we get addicted, and how we might get cured. Featuring not you, not me, featuring not our clients, featuring not our alums, featuring not our families, but featuring a monster of a fish. Now, I don't know about you, but I never looked like that. Oh, I felt like that sometimes. But I sure as hell would have never bitten an unbaited hook. But the point is this: how could we expect our governors, our policymakers, the directors of the Corrections Commission, or any of the other members of your cabinet, how can we expect the policymakers or the public or the news media or the president or the Congress, how could we expect anybody who had to deal with our problem to have any empathy towards us when they thought that we looked and acted like that? In 1997, I asked, what other chronic illness or disease featured an image of a creature that is less than human? I mean, back then I knew scores of people who had been afflicted by addiction. Afflicted, yes, the tragedy of addiction is undeniable. I know the consequences and the death toll from this illness, and none of the people, not even Matt, you talked about him in your open, Matt didn't look like that. I know lots of people who have died from this chronic disease. None of them look like that, and none of them come from families like this. But I also know lots of people who have recovered from this illness. Scores of people who have recovered from this illness. I saw them every day in my community of the Twin Cities or wherever I went. I saw thousands of people recovering from this illness, and none of them ever looked like that either. And so I wondered, where were we when it came to standing up and speaking out for the solution for recovery? Oh, there we are. There we are. These are conventions of recovering people. There are thousands of people in the audience there, and none of them look like this. There they are. They're in a Coliseum or in a convention center. Oh, and there they are too. This happens to be in Minneapolis. When the Convention of Recovering People that are in this program called AA, when they descended on Minneapolis in 2000, the banner headline in the Star Tribune said, 60,000 drunks descend on city. Subheadline, none get arrested. There were thousands of us out there. We knew them, and they congregated, and they weren't like this. And yet we were invisible, hiding behind our recovery, either out of shame or indifference, or not understanding the importance of standing up and speaking out. I'm in recovery and I look like this. We never said that. Even when people in recovery who are members, dedicated members of a 12-step fellowship, decided to appear in public, they oftentimes appeared like this. Now, Governor, I don't know about you, but if these dudes showed up at your office at the Capitol, you would call your security detail on them right away, right? If they had come to lobby a bill, let's say we have in North Dakota to add prevention dollars or treatment dollars, and they came wearing masks, nobody lobbies that way. Nobody who's in recovery from whatever the chronic illness is ever wears a mask. They meant well. But these were members of a group called Alcoholics Anonymous, and they thought they couldn't stand up and speak out. And so if they were, they had to wear masks. Why didn't we simply show up as the people that we are, even when we're wearing blue jeans? I kept hearing that Churchill quote, the scariest thing about being a leader is looking over your shoulder and nobody is following, and son of a gun, in the mid-1990s, we had this, but we didn't have this. How could I take the orders of my boss, the CEO of Hazelden, and go out and change public policy and change public perception. What could I do to help the recovery community understand, particularly those who happen to be in a 12-step fellowship, that they can stand up and speak out and put an accurate face, not on the problem, but on the solution? How could I do it? I got to tell you, it was the most frustrating, perplexing quandary that I had been in. And maybe Kyle, you could roll the script a little bit more. There we go. Thank you. Otherwise, I'd have to ad-lib and I'd be here for another hour. It was perplexing. It was a quandary. And 15 months into the job, I took this magazine cover. I couldn't get it out of my mind's eye. And so I made a copy of it, a big poster of it, and I hung it in my office. It's still hanging in my office all these decades later. And I saw this as the challenge. And yet I couldn't figure out how to do it and still honor the tenets of anonymity that were important to that recovery group that's been now sustained for 70 some odd years. I couldn't figure out how to do it. I couldn't figure out how to convince you to do it either. Until one day I was invited to give a speech at a Rotary Club in St. Paul, Minnesota. It was the very first public speech I'd given. It was on the impact of alcoholism in the workplace. Important subject, and the impact of alcoholism in the workplace. Now, I'm a journalist, worked at CNN, worked at newspapers around the country, so I know how to write. I wrote this beautiful speech about the impact of addiction in the workplace, alcoholism. And I got up there at that Rotary Club meeting just a little bit after that magazine article was out, and I began to deliver that powerful, persuasive talk about the impact of addiction. And 5 minutes into my speech, I looked out over the sea of 200 Rotarians, and most of them were doing this. Now, they had eaten the rubber chicken, and it was lunch, and so I know how that is. But it hit me. It hit me that day. If I wanted to convince my peers, my neighbors, my colleagues, if I wanted to convince people about the impact of addiction in the workplace, I couldn't talk about the problem anymore. I had to talk about the solution. And so I took that well-crafted speech and I put it down over by the podium and I said, actually, let me talk about this to you from another way, my own perspective. I said, my name is William Moyers. I'm an alcoholic and an addict in recovery, and this is what one looks like. You could have heard a pen drop. People were shocked. People said, You're on the board of a bank. You're on the board of 4 not-for-profits in Minnesota. You have a wife and 2 young baby boys. You live in a nice 120-year-old house in St. Paul. You're the son of Bill Moyers, the noted journalist. What do you mean you're an addict and an alcoholic? How can that be? You don't look like one. It was on that day, in late 1997, that I discovered the solution to this perplexing problem about how to advance public policy and how to get rid of the stigma. It's with our faces and our voices of people who look and live and vote just like us. And I've been doing that ever since, telling my story with my full name, my address, my place of employment, and I don't do it as a member of any specific recovery group because I respect the importance of the tenets of anonymity that are critical to that group being able to sustain itself and that are also critical to my ability to continue to recover. Telling my story to prove that addiction does not discriminate, telling my story to explain why addiction can cause good people to do bad things, responsible people to act irresponsibly, loving people to hurt those they love, and those who love them. For 23 years now, I have been telling my story to emphasize that treatment works. Remember, I needed 4 treatments over 5 years before I finally got it. 23 years of telling my story that treatment works, but that sometimes it takes more than 1 or 2 treatments to learn finally how to take the personal responsibility for managing this chronic illness. A chronic illness that has no cure, but as I said, a chronic illness with a solution. Telling my story to prove that with recovery, as Catherine so eloquently and directly put it, with recovery, anything is possible. And that when people like me recover from this chronic illness, we are once again taxpayers, homeowners, we're reliable employees, we are dutiful students, we abide by the law, we invest in our communities, we raise our families, and we vote. These messages are at the core of my vocation. They represent the essence of my journey and my passion. Every time I stand up and speak out, no matter what the venue, it is another milepost marking my journey of the past 20 years. But this is not just my vocation, and it's not just my journey, thank goodness, alone. Because from Fargo and Bismarck to St. Paul and San Diego and Atlanta, from the native reservations of the Great Plains to the campuses of private colleges and public universities, from drug courts to recovery community organizations to nonprofit healthcare providers and Fortune 500 multinational industries, people are coming out to share their stories of addiction and redemption and recovery, proving that not only that addiction does not discriminate, but also highlighting the promise and the possibility of recovery. Son of a gun. Son of a gun. If this message to stand up and speak out is not working. This is President Bush in October of 2008 signing the Paul Wellstone and Pete Domenici Mental Health and Parity and Addiction Equity Act into law. Think about it. Insurance companies had been discriminating against people with mental illness and addiction for decades. And finally, because we stood up and spoke out in 2008, President Bush signed this into law. And now we have gone from insurance companies being our adversaries to insurance companies sponsoring conferences like this one. 92% of our patients at Hazelden Betty Ford now use their insurance to access care, as it should be. And so we are making change. 2 years after President Bush signed this into law, President Obama included addiction and mental illness in the Affordable Care Act. And I know that's a contentious issue here in North Dakota like it is everywhere else. But in the Affordable Care Act, our illness that brings us here today is covered. And it is vital that no matter what happens, it's vital that no matter what happens, as your governor tries to figure out how to deal with it here, that he hears from you all as it relates to the importance of finding some avenue for us to continue to get access, even if the Affordable Care Act goes away, or what might come next. Policy is changing, and so is public perception. Look, 1997. 2007 and 2015. Now, we still haven't gotten to the point with the news media where they use our real faces and our real voices to feature the issue. They've gone from the fish, though, to a real human being being flattened by a glass of alcohol to at least the unbaited hook of prescription pain medication. They're not stigmatizing us anyway. We got to go a little bit further. We got to get the next cover of Time magazine to look like this. But we are changing public policy, and we are changing public perception. And finally, this. Here we are, 40,000 of us in October of 2015 on a walk for recovery at the National Mall in Washington, D.C. By the way, I know that guy up on the stage there. It's me. And I got to be on the stage in front of 40,000 people with Steven Tyler of Aerosmith and Joe Walsh of the Eagles and Sheryl Crow and a lot of other people, some well-known and some like me, just common Joe Q citizens who stood up and spoke out and said, this isn't the face of addiction, this is the face of recovery. And there we are in mass. Indeed, we have come a long way. We have come a long way, and today our journeys bring us here. Called together by the First Lady and the Governor, called together to share our insights and our expertise, our passion and our hope for recovery reinvented. I can't wait to hear from the rest of our speakers today. And to hear from some of you too. As the governor said, remember to text those questions in. Send the hard ones to him and give me the softball questions. What an honor. What an honor for me to get to be here with you all today. I can't even vote for you. I might have paid a little bit of hotel tax last night, but it wasn't much in terms of contribution to the local economy. But I get to be here with you all and your cabinet and the leaders of the state and my fellow travelers. What an honor. I'm going to go home here late this afternoon, go back to St. Paul, spend the night, and then go to Portland, Oregon from Thursday until Saturday to do the same thing and to march in a March for Recovery in downtown Portland on Saturday morning. What an inspiring opportunity we've had. But I'm going to go home, and you all are still going to be here. We're going to feel good about this day, but we got to remember why we're really here. And so before I go, I want to give you a call to action. I want you to think about this call to action in the context of what you're going to hear for the rest of the day, what you've heard already. And I want to give you this call to action in the context of what we need you to do when we all fan out here and go back to our jobs, our communities, and our families. If we are to succeed in reinventing recovery, Catherine, if we are to succeed in reinventing recovery, then, and by the way, I think this is a model we can take to 49 other states. Pretty fancy, huh? Pretty effective. If we are to succeed in reinventing recovery from addiction, we will only do so if we recommit ourselves to recovery advocacy. These recommitments require these steps. It is my call to action, and here we go. I do not have them up on the screen, so remember them or email me. Number one, if you're a person in recovery, and you know who you are, if you're a person in recovery, we invite you to leave this conference today and sometime between now and Sunday. If you're a person in recovery, share that with somebody who does not know it. It may be at your church, it may be at your running club, it may be in the line at the grocery store, but if you're a person in recovery, share that with somebody who does not know it between now and Sunday. Number two, if you're a family in recovery, one who has experienced the power of addiction, and the power of addiction is what it is. The governor talked about how many people are dying from our illness. You can be advocates too, because if you're a family member who knows the power of addiction and or the promise and possibility of recovery, between now and Sunday, if you're a family member, take your reality back into the community and share that with somebody who does not know it. Number three, if you're a professional who works in this field, and can I see a show of hands of professionals who work in this field? A lot of you. Start to talk about your successes. You don't do what you do for those high salaries they pay you. Why do you do what you do? Because you know that it works. You know that what you do makes a difference in the lives of people from families like mine. So if you're a professional who works in this field, start to talk about your successes. Whether it's in the private sector or the public sector, start to talk about your successes. The language, I ask you to drop two words from the vernacular. One is the term substance abuse. We use that term interchangeably, but a substance use disorder is one thing, but I ask you to let's drop the term substance abuse. Why? Because I never abused substances. I loved them. And to suggest substance abuse is to suggest a behavior like spousal abuse or domestic abuse or animal abuse. Yeah, there's some behaviors around my illness, but it's not a behavior. So let's drop the term substance abuse, and please, can we stop? Can we drop the term rehab? We rehab bad knees. We rehab new hips. When people get treatment, we don't rehab diabetics. We don't rehab cancer patients. We treat them. So let's drop rehab and substance abuse from our language vernacular. Engage the media. You guys have done that here in North Dakota. You get on the front page all the time. I never get on the front page. Engage the media and invite them to come to your treatment facility or to come to your graduation or to come to, if you're in the armed services and you're doing good work at the National Guard or wherever, invite them to come and see the work you do to help people like me. Engage the media and engage the policymakers. This room is filled with members of policymakers today, not just the governor and the cabinet, but other members of the government. Engage the policy people. Invite them to your facility. Let them see you. Let them hear you. Let them know that what you do makes a difference. Engage them. And if you don't know who they are, find out. Engage the media. And lastly, be open to many pathways of recovery, including the use of medication, the appropriate use of a medication. Not only so that people can find what works for them, but so that we can include others in the ranks of our cause. Indeed, there is strength in numbers. And we are the lucky ones, the ones who got well. And so it is our responsibility to change the terms of the debate for the sake of those who still suffer in shame, isolation, fear, and hopelessness. We know what that feels like. Let us stand up here in North Dakota to become beacons of hope, agents for change, and a hand for help for those who need and deserve a way out. A way out and a way in to recovery. Thank you very much.